Welcome. This is the Health and Wellness Coach Journal podcast. I'm your host, Dr. Jessica Singh, the founder and CEO of the Center for Health and Wellness Coaches. This is a podcast for coaches to explore topics related to health, wellness, and coaching, sharing knowledge and sharing light. Dr. Luftman is a board-certified physician with over 25 years of experience in family and sports medicine. He has served as an associate director of a family medicine residency program, director of a sports medicine fellowship, medical director for a national health plan, and chair of a regional sports medicine committee. He has also worked as an assistant medical director at a university medical group, assistant team physician for a professional sports team, and co-founder of a health tech startup focused on musculoskeletal care. His academic honors include being named a Dean's List Scholar at University of Southern California's School of Medicine and receiving multiple national and regional awards for clinical research. He was also honored as a Family Practice Attending of the Year by graduating residents and earned National Committee for Quality Assurance recognition for excellence in diabetes and cardiovascular care. With a career spanning academic medicine, private practice, and leadership roles in major healthcare organizations, he's earned recognition as a trusted clinician, educator, and innovator in the field. Drawing on both his medical background and personal journey through burnout and recovery, Dr. Luftman now focuses on helping healthcare professionals reconnect with their well-being. His mission blends clinical insight with accessible practices in quiet contemplation, attention retaining, and nervous system regulation, offering grounded support for those working under intense stress. A lifelong Angelino, Dr. Luftman continues to live and raise his family in Los Angeles. Outside of medicine and being a devoted dad, he's an avid meditator, indie music fan, amateur guitarist, golf enthusiast, and consciousness researcher. With a past that includes DJing and sports broadcasting for good measure. Dr. Luftman, it's such a pleasure to have you.
I appreciate it. Thank you. Happy to be here. This is amazing. Happy to share what I put together and what I'm trying to do with the next part of my career here.
That sounds like a great place to start. I was going to ask if you could share your story.
Yeah, so as you mentioned, and I appreciate the accolades, that was amazing. I've had a long sort of winding career, and unfortunately had a pretty severe setback with a near fatal heart attack a few years ago. And in the midst of that, had to do some soul searching, some finding, some figuring out. I had a lot of questions. And in the process of doing that, I actually started doing some writing, which I had never done before, and journaling and meditation things and retreats, all kinds of things that I started exploring. And in the process of doing that, I was able to hear, I would say, my gut a little bit better than previous. And because of that, it sort of led me on this path of writing a book. And it started out very clumsy and unfinished and really meandering itself, and with some help and some structure, I was able to put it together and published it last month. So the book is a accumulation of my life experience. So it's part memoir, but also I put in there the pieces of this experience that I've gone through that I can't quite take a ton of credit for myself. There was some serendipity and synchronicity and other things that led me along this path to all kinds of different things. And there was a period there where I felt like, although hard to measure, I was taking in more than in terms of just absorbing information than I was through all the time I spent in med school and residency and fellowship. So the story is really one of self-introspection and learning, but also trying to fit my story into a paradigm that I thought would potentially resonate with people who may be either quietly suffering or not quietly suffering. And there are parts of whatever I've learned that might be helpful. And so I'm trying to be helpful in a different way than I was earlier in my career.
And how would you say that medicine, obviously when we go in, there are these ideals of what healing will be, what helping will be, and service will be. How has this profound experience you've had changed how you've looked at those things?
Yeah. I mean, it's almost a 180. I would say, compare with where I was in my mid-20s with where I am now and what I've seen, it's a stark difference. There's something to be said from the wisdom of just being in it. And whether it's seeing our patients' experiences, their families, the people we train, and our own life experience, I think it's like the hindsight 2020 thing, right? And I think for me, it really is centered around that healing looked like something when I finished residency, and I felt like I was going out on my own and doing this. And now it looks like something totally different. And that doesn't mean it doesn't include a prescription here and there or a lab test or some imaging, but it means that there might be a lot more subtlety that goes along with it that can impact people. And there is I think, a real power to self-awareness that can be translated into that healing environment. And that's, I think, what I've tried to describe, and hopefully in different layers and aspects of the book. But I do believe that for a vast majority of healthcare workers, not just doctors, but nurses and techs and people in the front office everywhere, that there is something to be said for not only helping our patients, but helping ourselves so that we can help our patients better. It may seem colloquial, but I think there's a lot to be said there.
Of course. And for listeners, those who haven't yet, because your book has just recently come out, The Widowmaker's Gift, Balancing Science and Wellbeing in Healthcare, which I highly recommend to anyone listening to this podcast. Would you just mind summarizing it for listeners who haven't had the pleasure yet of reading this?
Yeah, thank you. And it is available. I just finished the audiobook as well. That was like 13 hours of recording for about 6.5 hours of talk time. And I decided to do it myself, the anti-AI version. So anyway, I'm excited about it. And I hope if it's better for people to listen on 1.5 speed, then, more power to you. The book encompasses getting sick, trying to understand a little bit better why. And in the process of that, because I was relatively young, under 50. I didn't really have any of the classic risk factors, but there was a lot of stress. And I think there's pieces of the book where I repeatedly just go through the aspects of, let's say, since the 90s till now, what the literature and the research looks like at better defining for us objectively what emotional, intense, repetitive stress can do physically to our bodies. And that seems to be better respected, understood these days, but it's still emerging, right? We still don't have a great blood test. Here's your blood test, here's your stress level. Now let's do this and see where it's at. But that's emerging, right? And I did link a couple articles that came out last year that are seeming to be getting a little bit better into the weeds on that. But I really was trying to put together my story in the sense of, here's what I didn't understand that I didn't know and what it led to. And maybe in going through that process, if you, the reader, are struggling, maybe there's something going on out there in your world that you just aren't quite aware of, or maybe you're treating symptoms but not the underlying thing. And I just felt like, of all the suffering I went through, and there was quite a lot, it felt like it was for a reason after I went through all this. And the reason, I think, is to do this, is to tell my story and see if it resonates, and that others can be helped by finding it before they have a near fatal heart attack and go through the kind of craziness that I went through, which I wouldn't wish on anyone.
I know that you go through more of the experience in the book and share your story. Even just hearing you talk about it now, I can't even imagine what it was like. And also from the perspective of a physician, where you care for patients who go through this, and then to have, of all things, a widowmaker, like that to happen to you.
Yeah, it's crazy. I tried to describe that in the book the best I could. But the feeling of, as a physician, as you are an ER physician, and others who've looked at EKGs just innumerable times, and maybe you've done a baseline for yourself, but to look at yours and see that, there really is no words to describe the sort of shock. For me, I couldn't believe it. It was like, this is not happening. I think it was just what I tried to do in that first chapter. And I remember when I sat down to write that first chapter of what that experience was like that day or that evening, I remember just being like, how do I get across in words when your mind is so outside the realm of what you're used to in processing, as many of us do in healthcare, this sort of objective means of rational sort of discourse going through symptoms, pain, whatever we go through in our process that we learn and we train. And now you don't even remember what that nurse just said to you, or you think you do, but it was jarring. I didn't want to scare anyone, but at the same time, it felt like the right thing to do. It felt truthful. It was like, this was my experience, and I hope it comes across in the words, but it was pretty crazy.
I know you had said you didn't want to scare anyone. And it's interesting also that perspective too, because then in medicine, especially when you see things over and over again, there's almost like this normalization that happens. And so it's okay, this person had an MI or they had a heart attack and now the acute event's over. But I think until we experience it ourselves or you're caring for a loved one, it's what's leading up to the event. How do they now reshape their lives afterwards? And it's not just like that moment itself, which is something that's a little easy for us to lose sight in. And not easy, it's just we're so concerned with doing what's best for the person right in front of us. And there's so many waiting and waiting. And so I'm
Yeah.
wondering what that was like too, because the whole adjustment afterwards, I know you went through it in the book so nicely.
Yeah, I appreciate it. I would say two different things. One is my experience. The experience was harrowing, but there's a gratitude piece in what it led me to and really leaning into that. And I hope that came across in the book because I tried very hard to not get into this place of victim mentality. And I worked really hard to get out of victim mentality in the midst of the work that I did in healing. I'm still healing. It is really easy for trauma victims and people who have just lived horrible lives, and we hear it, to get into this woe is me narrative. And I think it's hard to get healthy living in that. It's okay to acknowledge it and it has to be there. But this quote comes to me a lot. It came to me in the Codependence Anonymous meetings, others I was working with in the trauma realm. But this whole like, you're not your fault, but you are your responsibility. That resonated with me. Take the fault away little by little, understand what happened in my life, many of which was really out of my hands, and really acknowledge that pain. Don't push it away. Acknowledge the pain, acknowledge the trauma, acknowledge the situations. In this case, I made it public with the book. I went about that process very profoundly, not ignoring it or suppressing it, but also shifting from a place of just sitting there in that mentality so much that it really, for different people, it'll cause different things, whether it's addiction or paralysis or eating or whatever. But for me, I was able to, thank goodness, get to a place of empowerment. And I really feel like that is the theme of the book, which is, I happen to list the things that I found, and there's a lot of interesting things we can talk about. One is the awareness of what's happening. And for me, I could talk all day long about the heart attack, but really it was what I wanted to tell the story about was, how did I get there? And where was the lack of awareness of why I was going towards that? And then secondly, in finding these things that helped me, telling the story to people so that they can figure out what works for them, because I think it's different for everyone. So I just laid out there, I happen to find a bunch of things. Some people just find one thing. Some people go to 12-step and they're great, right? Some people find a medication or a doctor or psychiatrist, whatever. But there is no cookbook to this. So for me, it was, let's relate all this and then see where it takes people that hopefully, again, they can connect with. But I was trying to really impress upon the point of the self-awareness more than the sort of like, wow, this is all I've been through. Yes, it's a lot, but there's a reason for telling that story. And hopefully that came out in the themes of the book.
Oh, for sure. One of the things I really loved about the book was how even very early on you had said, I think it was in the letter to the reader, that this was meant to be as preventative medicine. And I love even the way you so thoughtfully put the reflections through the book about having it be a partnership. That's what we're trained to do. I didn't learn this until coaching, which was after all my medical education and training, where
Yeah.
you view the person you're coaching as wise, resourceful, and whole. And it's a thought partnership. And so when I saw that in your book, I was like, oh, this is so beautiful. Thank you. So I'm wondering, organically, you got there. And so
Yeah.
that was the inspiration for that.
Absolutely. And so thankful that we live in an environment now, as much as everyone's complaining about the world we live in, and there is plenty to complain about. I get it. I even wrote in the book to watch these talks that Ram Dass gave in 1970s and 80s. The wisdom of people across the ages that is now available at our fingertips with a little tap for 10 seconds. It's incredible. And I was able to pick that up. I was able to learn what I didn't learn, which was that my boundaries for healing were not good, that I was disempowering patients by trying to do too much to fix, and that the partnership is not only critical, but it's probably detrimental if it's not there. I hate to say that to people because I know they're trying their best and there's no intent to harm. I get that. But if we do too much and we disempower people, I think that it makes them more disempowered, and it really takes away their agency to feel like they can come back from this or whatever they're suffering through. I appreciate that. That resonated with you because I felt like in my process, I had to sit in a 12-step meeting. Thank goodness it was anonymous and I didn't see colleagues or friends or patients, but it's hard to be a provider and to sit in a 12-step meeting. This place that I sent so many patients to over the years, and now I'm sitting there realizing I don't have good boundaries in not only my career, but multiple aspects of my life. And to hear on that end of it, people's stories of getting better that all really, not all, I don't want to be hyperbolic, the majority were partnerships. It wasn't someone told them to go do this and then they just got better. It happened once in a while, but I think the vast majority lived in a partnership arrangement with something or some piece of philosophy or something that resonated with them that they connected with, and there was a shared experience.
Yeah. uh, Talking about having that insight for yourself. Also, it's just like going through your whole life, not even realizing they're blinders. And I think that's the universal element of just any spiritual growth, regardless of religion or background.
Yeah, I think each of us has an upbringing that has belief systems, it has some ego formations, it has all kinds of, let's say, biases that get put in, whether they're inherent or not, based on just the environments we're in, plus genetics, of course. And I think I wrote that in there. I was working with someone that was helping me with the book and the editing, and I had the statement in there. I'm sure you saw at least, I think, 3 times where I wrote, "You don't know what you don't know." And it's so ridiculous to say it. It felt like it was such a cheap thing and so colloquial, and it worked for me. What I didn't know was that the symptomatology I was having was rooted from a deeper thing. I just didn't know it. I understand the symptoms. Yes. Could I talk to my friends and colleagues about it? Sure. Could I get a label or an ICD-10 diagnosis and some meds? Sure. I think what we don't know, because there's only so much time in training, there's only so much bandwidth to learn all of this. There's things that you can't possibly just get to in a lifetime even. The purpose on the side of the book is just, hey, this is what I didn't know. Maybe there's things you don't know.
Sometimes horrible things happen, like having an MI or whatever it is. But then there's also like what you've done, be able to take the light, enrich, and learn, having survived. It's one of those I felt in the book too. It's like maybe you don't have to go through what I did in order to do this for yourself before something like this happens.
Yeah. Also, now that I've been sharing my story and talk to people at work, there's been a lot of encounters with especially healthcare workers. I did touch on this in the book, where it's easy to downplay our stuff, right? You're hearing and seeing terrible things. And it's so easy, just even subconsciously, it's not even consciously, to just be like, I don't have that. That's not in my life. Or thank goodness that didn't happen to me. And no matter the import or severity of your own thing, it's easy to find some narrative of a story, a patient, a family that I don't have anything to complain about. And I think there's something to be said for awareness again of, this is my stuff. I got to be the one with this brain and this nervous system trying to go to sleep at night. Even though their issue was worse, it doesn't mean that whatever happened to me that's easy for me to trivialize is not affecting me and changing the way that I'm managing relationships or whatever's happening, that somehow it's impacted by these things that may seem to others, if I tell the story, that person's going to judge me and say, oh, that's not that bad. But it doesn't mean it's not really having a significant, whether it's physiologic, emotional, mental health impact. And so I think I encourage the reader to just take a look at your own story. Don't worry about what that other person or that patient or family went through. Are you seeing issues that are happening? If you're not, that's great. Live your life. Maybe this is anticipatory guidance. But if you're looking for help and you're not really sure why, then there's probably something to look at there and not downplay whatever your own life story has been, because it may be more impactful than you really know.
That is so huge. Especially, I don't know what it is, but I was so surprised. One of the biggest advice that I got after transitioning, because even if you want to do holistic health and healing, there's like the operations behind it. First thing is mindset and how do you talk to
Yeah.
yourself? And so it's that issue of trivializing what we talk to, but then the normalization of things that we see in medicine, like even among thoughts of not wanting to live, or am I going to be around, or am I going to die? I can't tell you how many times you've probably heard too, residents, fellows, students say all of these things that are normal. And it's like, when are thoughts of even just joking and sarcastic? That should never be
Yeah.
common as it is.
Yeah, I would change it a little. Say not necessarily common because it is common. I just think that if it is what it is, and this is the realistic nature of the stressors going on in our current environment and the way we live, with all of the things going on in medicine, outside of medicine, in technology, etc., then sure, I'd like it not to be common that people are having these thoughts. I would love that. So would you. So would everyone. But if it is happening, let's not colloquialize it. And I wrote that in the book too. I don't know if you saw, but I stopped using the word meditation specifically because it's getting so watered down. It's the butt of jokes and it's thrown around on TikTok, and that's fine. And people could do whatever they want. I'm not judging it. I'm just saying, like, that word, I was trying to come up with a new one. I used quiet contemplation. There's lots you can use. I just decided to kind of redefine it for myself in the reader. I'm going to give you a different way to think of this thing because meditation, it feels like it's been just so dumbed down in many ways and just like everything else become just one little piece of the pop culture. And so I do think that mindfulness is really helpful, but I was trying to present it in a way that's different and hasn't been watered down. So again, that's my perspective on what you're saying is if it's going to be common, then let's make sure we are addressing it in a way that really speaks to individual people and what they're going through and not having it be so colloquialized or so normalized that people aren't recognizing for themselves what that means, right? And that they're not going into what I had, which is this place of real despair at one point in my life. And then obviously this place where I almost didn't make it, and that they don't have to be asking or at least saying the I didn't know what I didn't know piece because they are building a little bit of awareness that maybe the younger generation now can have that many in my generation and older just weren't privy to.
100% agree. Yes. It was just the silence. And you use quiet contemplation, and this is just loud, silent, agreeal
Okay,
processing.
perfect. But I do feel strongly about that. I think that we're going to have to talk about this in a different way. And I don't want to put any mandates on it. I hope we can. I hope we can talk about it in a different way. And I hope we can have discussions like this and have discussions at training programs and at hospitals to really speak to the pain that people have that unfortunately maybe they're having to laugh off because that's where we've gotten to, but give people space to figure that out for themselves and how to find a way out of it. Suffering is not fun.
This is so important, and it's so inspiring actually to have someone, especially you, with all the background and leadership roles you've had, because redefine what success is from a human level. Because there's all this, you look at your CV, it's amazing what you've been able to accomplish in your career. And there's this trajectory in academic medicine that's like that. And even in the community, there's RVUs, productivity, all of these external metrics always placed on providers on what defines success. But then to actually have someone say, wait, this is not all of you. This doesn't define you as a human being. This is what happened. Look at this. This is just as important, if not more important. It redefines holistically what success is in life and medicine, not just career. And I know you've seen it. It's how often in medicine, it's if I'm not somebody's doctor, I don't know who I am. And then people retire later. So what you're doing is enormous and so inspiring.
I appreciate it. Thank you so much. What you're talking about is beyond critical. All I can do is tell my story. I don't know if it will lead to changes in curricula development in med schools or nursing schools or residency programs, but it's more than the curricula, right? There's a certain knowledge base that we all have for our communities and our society to say, okay, we are now putting the trust of another human being in your hands. I get that. But I think there's something to be said for people who have been through it to go back to the younger generation who's either in training or maybe shortly out of training and say, I know it looks great to rise up and become the dean of a med school or run this residency program or get 100 publications. No question, those are things that are great. But I think that many of us are wounded healers, and there is a pervasive sense of imposter syndrome that runs through us. I know this because as I've told my story, I'm hearing it repeatedly now, just in a short period of time. That's very hidden and very quiet, but it continually, with that voice in our head, which we often can't hear till we slow down a little bit. I talk a lot about that in the book. But until we slow down and hear it, that we can't hear that it's telling us, yeah, I know I just took care of a really difficult patient. I just had 3 nights on call. I just did, but I got to do more. I got to do more. And it will keep going no matter how, if it's 100 publications, it's got to be 150 because this other guy did this. And I only got 3 in JAMA. It will never stop for the vast majority of people. I believe that. That's what I've seen. That's what I've experienced. And looking at what a quality life looks like with happiness and all of that. I think people are getting at it. I think there's research, and especially other countries, and what does quality of life look like? But specifically for wounded healers, which is, I think, a large percentage of healthcare workers, it looks very different, because I don't think that success can be reached. It's always, I got to do more. I got to find more. I got to heal more. I mean, in chapter 6 is my wounded healer chapter, and I talk a lot and reference this book by Alice Miller. She talks a lot about the grandiosity. And then when it falls, for some reason, that it finally hits you, that I can't hit this level that I really want to hit, or I've done all these things and I still don't feel right. I still don't feel like I should even be here or whatever. Like, you hear these stories left and right. And I think she's right. The collapse happens when the grandiosity fails. And that can be drug use. It can be suicide. It can be failure of a marriage. It can be, you name it, right? It's going to come in so many different forms, depending on who the person is and their upbringing and their current state. But it's probably going to happen. Drama of the Gifted Child. A great book. And I think that is just so important. And it's a nuanced thing. I don't think you can put it in a book, and I think you can only have so many lectures. I think it's those interactions amongst a mentor and a student where those examples can be given that it really comes across as to, yeah, I can do these things. It doesn't mean you shouldn't work hard to do better, make more money, whatever. Those are fine. But it's about how you're defining success in your life, right? It's not necessarily that you can't do more. People should strive to do. I have no problem with it. It's just where it is in the context of your psyche that's building you up. And if it's holding you up in this false way, that's when the falls tend to be really precipitous.
The word that's coming to me right now is brave, which is just, as you shared your story in the book so authentically, brave. And then just as you're talking about all this, defining what your meaning is, what your purpose is in life, just when I got to that part of your book, like the last third, maybe about a third, and you go into spirituality and consciousness, I was like, this is incredible that this is what came after, in light of all of this together. And so you did this in such a way that was introductory. It respected the cultures you referenced, but it was not advocating for preaching anything. And it was just so thoughtfully done. And so I'd love to just ask, what role did that spirituality, evaluating that question for yourself, your purpose in life, help you through all of this?
Yeah, immeasurable. But I didn't know it until I sat down, and I think those first few meditation sessions that I talked about in the book, they were jarring, right? The fact that I couldn't sit there for 15 minutes with my thoughts without getting really upset, like nervous, anxious. I thought, like, for a lot of people, and I wrote this, they'd just be like, well, meditation's not for me. I can't do this. And that's how a lot of my family and friends have been when they've tried it. And I was just the opposite. I'm like, wait a second, this can't be good. That I can't sit here for a few minutes with my thoughts watching this thing. And I think as I delved into that, trying to understand, for whatever reason, I just found that it was interesting. It opened up all these doors. And I'm so happy that I have so much gratitude that I don't know how I ended up there. I just did. And it was a blessing that it brought me to that point even before I got sick. And I think it helped me through that time period tremendously that I had found it. I think that's why I felt like I had to write a book. I was trying to tell the story to people, and I would go through it, and it was so layered and complex. They'd just be like, hey, I think you need to write this because there's a lot here. And I'm glad I did. But the spirituality piece, I did want to be careful about it because I found people through the years a lot who are actually very triggered by that word, right? They grew up in households where spirituality is tied to religion, which was tied to dogma. I'm not making judgments about it. It's the stories I heard that I don't want to hear about spirituality. It does nothing but bring me grief. And that's their way of defining that word that was related to their experience. Spirituality for me was an open book, unwinding of years of spooled tension of string within myself and my core. But it's not that way for everybody. So I really tried to present it in a way, number one, this is just my experience. I went to the sound bath. This is what happened to me. Maybe you'll sit in a sound bath and you'll just be like, this doesn't work for me. This is what happened to me when I went to a sound bath. This is what happened when I went on retreat and I really was quiet for a few days, right? And it was an incredible dichotomy of feelings there. And I happened to find something both within myself and outside of myself that I hadn't recognized before that has really helped me a lot. Maybe it'll help you too. I don't know. But I wanted it to be as open-minded as possible because there's a lot of people out in this world now preaching. And that's the last thing I wanted to do. I did not want to preach or tell anyone this is what you got to do. This is just what worked for me. And I'm so glad I found it. And I have a lot of gratitude. Maybe it's interesting to you. You want to look at it a little bit more.
You did it. And it came off that way too. Very gentle and very like, here's just so you know this is out there.
Great. Beautiful.
And
Thankful for that.
no, thank you for putting it together because it's also something that we don't normally get in medical education. And so when you read it, regardless of where that first seed is planted, you never know what will happen for somebody.
Yeah, exactly. I think that's absolutely true. The last piece I'll say here about this is I think that it's important. I talked about it earlier, but the cookbook thing, everyone's going to have their different piece of it. And, what I say in there may be triggering for people. And I get it. And I put it in the intro and I hope it's not. But I can't speak to everybody. All I can do is just say what's here. And if it doesn't resonate, I'm sorry. And I hope it doesn't make things worse for you. But I think once I started talking, let's say, even before I got sick, but especially after I got sick, about the struggles I've had, and I really opened up to people that I hadn't before, I think the reaction I got was that even if it doesn't necessarily resonate, or you can't think of a time when you've been through trauma or you don't have a lot of anxiety, whatever, there's something about being honest and being vulnerable that people really like, at least people in healthcare, I would say, and some family and friends too. But that alone seems to connect people. And so for me, it was like, okay, if nothing in the book content-wise resonates, maybe just telling my story in the most honest way possible will.
Because at the end of the day, again, that universality of just being human.
Yeah, exactly. Which is hard. It's hard. There's this term dukkha that I used in the book, which is a Sanskrit Buddhist, relates to this, which again gets so colloquialized that Buddhists feel that all of life is suffering. It's not that. It's that unsatisfactoriness, which is probably the better translation of that term. I said this to someone the other day and they were laughing. If you go to the grocery store and you stand at the end of that cereal aisle, there's a little bit of suffering there, right? You're looking at all these cereals, but like you got to go choose, and your brain's can probably go through, well, this one, that was too much sugar and fiber and whatever you process you go through. There's like a little bit of suffering in the cereal aisle. And so I like that story because I think it just relates to us. You go to a concert that you love and it's amazing, but then guess what? You get to withdraw a little bit because now you don't have that great concert anymore and you're looking forward to when the next one. I wonder when the next one will be. And this artist I love isn't coming till next summer and I got to wait. And again, a little bit of suffering. And it's like ubiquitous through our lives. This happens. Being human is hard. It is hard. And I think the more that we just, okay, it's, I'm accepting of it now. I've seen the pain. I've seen my own pain. I think that acceptance and awareness is huge at leading to growth.
Absolutely. That being said, so in terms of winding up this podcast episode, so with the takeaways, mainly for coaches and healthcare providers, so those helping others, it's also the biggest takeaway I'm hearing from you from this is also having that self-aware. In order to help anyone else, you have to have a deeper awareness of yourself, and it's going to look different for everyone.
Yeah.
And so I'd love to ask what your takeaway is for listeners today.
I hope that there's understanding, and especially I know you do coaching, so obviously you're going to have the podcast for coaching, so you're going to have coaches too. And I guess it would be that self-awareness is sexy. It's cool. It's cool in relationships. It's cool on social media. It may not be cool to the cool guy who thinks that showing off his jewelry or his money is okay. Like, I get that. But I think in the world and the realm that many healthcare workers live in and coaches live in who are helping people who are suffering, that self-awareness, understanding that looking a little deeper into what's happening and the way my inner voice is talking to me, the way I'm relating to others. Maybe the belief systems I developed at a younger age were based on notions that I'm actually not sure I really resonate with anymore. The biases that I've learned. That bit of self-awareness, maybe done with coaching, maybe done with therapy, maybe done with reading books, whatever it is really so powerful. And I learned that. I had to go through something to get to the other side of that. But it has been an incredible journey for me. And I think there's real valuable lessons in looking a little deeper, even for providers who are teaching and nurses or whoever it is, like teaching patients to look deeper, but can't look at themselves. That, yeah, it can be scary to look inside. There's no question that there's going to be hurdles. But at the same time, I think the benefits that can come from it are so innumerable in terms of reducing our suffering in life and leading to hopefully better things. And none of that's black and white. There's a spectrum there, as we all know, but just taking stock of where sort of a human being is in life and trying to improve the quality of that life, whether doing it in, as I talked about earlier, for ourselves, to better ourselves, that then carries over to those we are working with or taking care of. All of it extends, I think, out significantly. And then there's I believe, without going in depth into it, because I know we're wrapping up here with this sort of global consciousness, there's a larger scope that gets spread out amongst that. It's very hard to measure and it's hard to really do research on it, but I believe it's there. And I think that these types of insights that lead someone to self-awareness, I believe it will spread. That's my belief. It's not a fact, but I believe that information, that caring, the empathy, the compassion, that it somehow takes root and then it grows just so many things in our environment. So that's my opinion, my 2 cents.
Well, thank you so much for sharing all the sense of wisdom and light that you have. And your book, I'll put the link for in the show notes. It was such a pleasure getting to talk to you today.
Great. Thank you so much. I really appreciate it.
Thank you for listening. I appreciate you and value your feedback. So please subscribe and write a constructive review. If you'd like to be informed of new episodes and offerings and resources for coaches, sign up for our email list at www.centerforhealthandwellnesscoaches.com. Sending you warmth and light.